joined now by the organisation's spokesperson, Dr. Margaret Harris. Hello to you, Dr. Harris. Thank you for joining us on the programme this morning.
Thank you for having me.
Talk to us about the latest that you're hearing and the work that you're doing.
Yes, and I think you're illustrating what kind of work we're having to do and will be doing in future by your reporting from the refugee camp. The immediate needs, obviously, are to get people out from under the rubble and to deal with the crushed wounds and the immediate damage. But there's so much long-term change to people's health, just like the gentleman who's found himself immobile. And we are bringing in a lot of supplies for surgical and trauma care, but also what you call assistive technologies, things like wheelchairs, things that can help people resume their their lives as best as possible with the injuries they've received. We've got early damage assessments, and we know that at least 15 hospitals have been damaged in the area and hundreds of health facilities. But it's quite also, of course, health workers have had to be repurposed to go and look after the immediate needs of all the people who've been injured, also to deal with what they've suffered. We've lost health workers, and to deal with their families and all the many disturbances in their lives. We are bringing in a lot of supplies. We managed to get supplies to 16 hospitals in northwest Syria on Monday because we had repurposed supplies that we could get to them quickly. And we are, as I said, doing further and further damage assessments and working to bring in emergency medical teams at the request of the country, so that they're the people who can actually provide the right services in the right places.
Yeah, I'm reading about 3 charter flights that should be carrying medical supplies, trauma kits, etc. Have they arrived yet?
No, not yet. So they're in our Dubai hub and waiting to go. They're exactly right. They're packed with 160 metric tons for the plane that's planned for Syria. I haven't got an exact departure time or where it's going to yet, but as soon as I know, we'll certainly release that information.
Yeah, Syria particularly challenging for you.
Indeed, but these are areas we've worked in, and Syria, I mean, we've already had 15 million people there who have been needing help, who've been in a dire humanitarian crisis before this happened. And so, as you mentioned, we're saying it's a crisis on a crisis. But I guess if there's any good thing, it does mean we've got teams on the ground. It does mean we have a lot of people who have already been repurposed and can have been mobilized to do the utmost to try to limit the harm, if that's the way of putting it, of this terrible, terrible disaster.
Yeah, talk to me about the death toll. The latest that we're hearing is almost 9,000. You were predicting up to 20,000. It's impossible to say at this stage, isn't it?
That's right. It's impossible to say. That was one of my colleagues who was looking at what had happened in past earthquakes and disasters of this nature. But that's just a very general thing. Each disaster is different. And of course, the work going on to get people out is extremely important. We won't really know the extent of these losses and for quite some time. And the important thing is to prevent people who've been injured or who've been affected by this from also dying. So you have things like babies being born. We saw a baby that was born under the rubble yesterday. Babies will be born in the next few days to people who are sheltering in cars, who are in dire situations, and that is not a situation you want a child to be born in. People who've got chronic illness, who need diabetics, who need to get their treatment, people who have hypertension, and the stress may lead to heart attacks. So all those health services need to be provided as quickly and as close to the people who are currently suffering.
Doctor, some modelling that I've seen with the help, I'm told, of the World Health Organization suggest that the numbers could go up as high as 60,000 deaths. Is that a number that you would recognise?
So again, this is not something we could say yes or no to. What our job is to prevent those numbers going as high as possible by bringing in as strong and as appropriate and fit for purpose health response.
Yeah, and that, as you say, will be in the form of things like medical supplies, etc., etc. But a lot of the infrastructure is damaged here as well, not just in southeast Turkey, but also in Syria. What can you do to help with that?
So again, what we've found works is to bring in emergency medical teams who basically come in with their own infrastructure, with their own skills, their equipment, but they have to be the right teams for the right place. So that both countries have asked us for specific types of emergency medical teams, and we've put out a call immediately on Monday, and we're bringing those in. Other things that are needed. So essentially, you've got to set up a system on the spot, like field hospitals, but where it is rather, because again, exactly as you said, the infrastructure is so damaged, you don't necessarily have a hospital that's functioning. But where infrastructure is usable, it has to be in, then you support as needed, as appropriate. So that's exactly why we're doing a damage assessment, to look at what is working, what isn't working, what can be put in place very, very quickly to try to achieve some kind of level of functioning of a health system.
When you say very quickly, of course, that's all relative, isn't it, for somebody who is still stuck underneath rubble. Records show that if we don't find them today, then they're not coming out alive. What else do we have to factor into a timetable over the next few days and weeks and months and years?
Exactly. So for people under the rubble, there is still hope, but it does indeed make it harder because they've suffered from the dust inhalation, they've suffered from their crash injuries, so they haven't got the immediate care that could help them survive this. But in the midterm, or pretty much the immediate term too, we've got to look at preventing infectious diseases. So again, people who are crowded together in very cold circumstances and difficult circumstances, whose immune systems have been under tremendous stress from what they've experienced, and the grief and the shock and the uncertainty. So there is likely to be a surge in respiratory infections, because we've got a lot of respiratory viruses. So all the viruses that we've been suffering all winter haven't gone away because of the earthquake. There's a risk because of the damage to the water and sewage systems. There's a risk of waterborne infections, such as cholera. We've also got a risk of there's going to be severe mental trauma. So we need to bring in the psychological, psychosocial support right from the start. That's not an afterthought. That's not a luxury. That has to happen right at the start. And again, getting the essential medicines to the places where people need them is critical, because there are a lot of people who are on medicines that, if they can't have those medicines, the illness that it's keeping at bay will return and could kill them.